Why did Vietnam War veterans struggle with addiction? Have you ever wondered why so many Vietnam War veterans face challenges with addiction? The answer lies in a mix of their experiences during the war and the struggles they encountered afterward. Many veterans turned to drugs like heroin while serving in Vietnam. This was often a way to cope with the intense fear and stress of combat. The conditions of war were harsh, and the psychological toll was immense. During their time in Vietnam, the availability of heroin was high. For some soldiers, it became a means of escaping the trauma and anxiety associated with warfare. Unfortunately, this early exposure to drugs often led to continued addiction once they returned home. The psychological impact of the war played a significant role in these struggles. Many veterans suffered from post-traumatic stress disorder, depression, and anxiety. These mental health issues are closely linked to a higher risk of substance use disorders. Veterans with these conditions often turn to alcohol and drugs as a way to self-medicate and manage their symptoms. Reintegrating into civilian life was not easy for many veterans. They faced social isolation, unemployment, and a lack of support systems. These challenges made them more vulnerable to addiction. The transition from military to civilian life can be overwhelming, and without proper support, many veterans found themselves struggling. Additionally, exposure to chemical agents like Agent Orange during the war added to their long-term health issues. Many veterans dealt with chronic pain and disabilities, which also contributed to their reliance on substances for relief. Statistics show that Vietnam veterans had higher rates of drug-related deaths and unintentional poisonings compared to their peers who did not serve in Vietnam. This indicates that their struggles with substance misuse were persistent and serious. Interestingly, attitudes toward drug use among Vietnam veterans were often less negative than those of veterans from other conflicts. This might reflected how drug use became normalized during their service. The complex history of the Vietnam War created a unique situation where combat stress, early drug exposure, mental health challenges, and difficulties adjusting to life after the war all combined. Understanding these factors is essential for addressing the long-term health effects and providing the necessary support to veterans who have faced these challenges.